Good afternoon, everyone, and welcome to the election shakeup. We're going to be talking about the new Congress, new administration, and the future of healthcare policy. My name is Joel White. I'm the CEO of Horizon Government Affairs. Horizon is a bipartisan firm in Washington, D.C. and the states. We're focused exclusively on healthcare issues, and so we're going to be talking about healthcare in the next over the next 2 years in the context of the election. Prior to founding Horizon, I worked on Capitol Hill for 12 years and worked on 9 different laws. Joining me today is John McHenry, a longtime friend. He's the vice president of North Star Opinion Research, where he oversees their fielding procedures and methodology. He did a lot of work to establish guidelines for the political campaign committees, the NRCC, to ensure comparable data across polling firms in individual contest and committee roles in order to better organize on the ground responses to campaign and election developments. So before we start, though, I want to just tick through a couple of housekeeping items. First, the webinar is being recorded. Second, we are not doing live Q&A, but if you've got a specific question, just use the Q&A button there at the bottom, and you can submit it, and someone on the Horizon team will get back to you, or John will, and we'll respond after the webinar. So, John, thanks really for being here. Love your work. We've worked with you for a long time, and looking forward to getting started. So today, we're going to talk first about the election results and some key trends that we saw, presidential, Senate, and House. Then we're going to talk about makeup of Congress and some of the intrigue that's going on right now with the House and Senate changes, who's in the leadership, who's not, and who's chairing the various committees. Then we're going to talk a little bit about what's next, what's going to happen over the next 2 months with the lame duck and with the transition getting into next year, and then what are we looking out for in 2025 and beyond. And so now I'll hand it over to John. He's going to give us some insight into what happened at the polls. John?
Thanks, Joel. Great to be with you as always. Always glad to help our friends at Horizon. And it's obviously a fun election cycle to talk about. It's interesting to see everybody's reaction to, oh my gosh, Donald Trump swept the swing states. He's at 312 electoral votes. How did he possibly win the popular vote as well? And the question to all pollsters is like, how did you guys miss it? And the pollsters' response is, it was a 2-point race nationally. Margin of error on national polls is 3 points. In a lot of the state polls, it's 4 points. So, everything is basically right in the range, with a notable Iowa poll, an outlier. One of the interesting things in this, though, as we saw, especially in the last week, a lot of 47-47, 48-48 type races. One of the questions we asked throughout the cycle in swing states and swing districts in the House races was thinking about your own personal finances. Were you better off when Donald Trump was president, or are you better off now when Joe Biden is president? That question was never close. That question was very consistently about 50% for Donald Trump, 40% saying they were better off under Joe Biden. And that number ends up being essentially where Donald Trump maxed out. This race really came down to, do you vote for Donald Trump's economy, or do you vote against whether you want to call it democracy or you just want to call it day-to-day chaos? A lot of voters, I think, wound up voting along those lines. The Madison Square Garden rally probably capped the momentum that Donald Trump was having over the course of the last 2 weeks, where we saw him ticking up a little bit, maybe gaining a half point in a couple of the national aggregate surveys. But once people saw that, oh, that's right, there's some things about him I don't care for, it sort of stopped his momentum. But he, ultimately, when people walked into the polls, that's what they decided on. The shift is interesting here. This comes from the New York Times. I think you've all probably seen this map. The red arrows show a shift towards Donald Trump. The blue arrows show a shift towards Vice President Harris. you see not a whole lot of blue blue arrows on this map. The thing that strikes me in looking at this map is the cluster of counties in sort of suburban and exurban Atlanta, which is the only real big sort of blue chunk that we see in this. Those smaller counties like Rockdale and Henry and Paulding are outweighed by the bigger counties like Cobb and Fulton. But part of these arrows is that as you look at the exit polls, as you look at the polls that we did beforehand, college-educated men didn't move at all from 2020 to 2014 or 2024. College-educated women actually shifted 4 points towards Donald Trump, and then non-college educated women shifted 4 points towards Trump. Non-college men, as you could sort of see coming, went 6 points towards Donald Trump. But it really wasn't just a group that moved the national numbers. It was virtually everyone except for the college-educated men who shifted at least a little bit. That doesn't mean he won all those categories, obviously. The 4 points better among college-educated women meant that Donald Trump lost by like 30 points instead of 35 points. But obviously, in the overall numbers in a state like Pennsylvania and a state like Michigan, that does make a huge difference when you're talking about a race that's going to get decided by a point or two. Senate results, we're recounting Pennsylvania, but as you look at these, basically you see West Virginia, Ohio, Montana sort of coming back to where you always thought that they should be. Sherrod Brown, senator from Ohio, John Tester from Montana, always seemed like outliers in a state that had been increasingly red, that they were able to hold on to their seat. Some of the other interesting states are Arizona and Nevada, where Donald Trump winds up winning those states at the presidential level, but the Democratic candidate winds up winning at Senate level. Excuse me. That's extremely unusual in what we've seen over the last couple of cycles. You almost always see the Republican candidate win if the Republican nominee wins that state. Same thing with the Democrats. There's very little ticket splitting at the presidential and Senate level, but we certainly saw that this year. Let's move to the next slide. So as I said, Ohio, West Virginia, Montana sort of reverting back to the norm. Pennsylvania is the really interesting race to me, decided by 0.5 point, where McCormick does win narrowly. At least we think so, unless the recount wipes out 40,000 votes. But interesting that he trailed sort of the whole way through the race. But as I know Joel will tell you, the warning sign for Casey is he was never at 50% in this race. For someone who's been in office for 18 years to have never hit 50 is a warning sign. We could see that in the last poll that we did in Pennsylvania, where we had McCormick down by 3 points, but with a 4-point Democratic advantage in the electorate based on registration, you could see that there was definitely an opening. I think Casey in our poll was only at 45, 46%. So he gets very little of the undecided at the end, and McCormick sort of blows past him. McCormick, I think, thinking about someone who actually did essentially what Donald Trump did in the state, one of the things he did was less run against Bob Casey and more run against Kamala Harris. He, in one of his sort of long form web ads, spent a lot of time talking about how terrible Harris was as a nominee and all the different things, being against fracking, not doing much on the border, and just focusing like a laser on her and saying, Bob Casey thinks she's great. So sort of essentially running against Harris, which turned out to be a great move in that state.
And let me pick this up. So every cycle, Horizon Government Affairs takes a look at all the candidates that are running and figures out where they are on healthcare. We look at their past history, we look at their campaign promises and materials, and talk to the candidates themselves. This cycle, we spent a lot of time with Bernie Moreno and Tim Sheehy, both of whom are coming to Washington. Both have a strong interest in healthcare, each with discrete, I would say, micro issues within healthcare. And we're really excited to start working with them. Senator Moreno, in particular, Senator-elect Marino, in particular, took on some of the Inflation Reduction Act issues around drug pricing and what was happening in the plan markets, where we saw a lot of disruptions, a lot of increased premiums, fewer plan choices, and successfully, I thought, at least took a couple points off or even neutralized the issue for Brown. In Montana, Sheehy focused on his background in supporting access to care in a rural area and helping with clinics and health systems to make sure that people had access, strong support for telehealth, and a focus really on more competitive markets and transparency for consumers. So they're coming to DC with a great interest in this. I think that'll be helpful for them as we talk about like what's next in 2025 with reconciliation. And then Jim Justice, you know, the guy was not going to lose. West Virginia is a Republican state. Trump carried it. If he could carry it by triple digits, he probably would have, but it was plus 40. And he comes in with a lot of gravitas and background dealing with the issues in West Virginia, particularly opioids and fentanyl. So a trio here of the ones we know, and then we're waiting on the Pennsylvania results.
Interesting thing in the House results, we're showing 218 for Republicans at this point, but the administration is going to bring some of those folks into the administration. Matt Gaetz actually resigned yesterday upon hearing that he was going to be the nominee for Attorney General. So we're really sitting at 217. There'll be a special election pretty quickly in Florida, and that'll be a solid Republican seat. But we might have a little bit of a lull where not much can get done because we've got some new cabinet members who aren't able to vote in the House. One of the interesting things in these House races, I talked about the importance of the economy overall on the presidential level. House races varied so much in sort of what wound up being run on. The Arizona 1 race, which is essentially Phoenix suburbs, a little bit to the east of Phoenix. That race we worked on with the committee was very heavily focused on immigration and essentially kids in school, what Amish Shaw's track record was in voting in the Arizona State Senate versus what voters really wanted in terms of education for their kids. So it was a very different issue mix there. A race like North Carolina 1 that we didn't quite get home on, but that race wound up being a high single-digit race until the last couple of weeks, and then they started just running his support for some organizations that had supported drag queens, and that race narrowed, not quite overnight, but over the course of the last couple of weeks. An issue that the committee wasn't exactly thrilled to be advertising on. How do you pull that off sort of tactfully? But they wound up being a very close race because it showed folks a different side than what they were expecting out of the candidate. The race in Washington, where the Democrat does wind up pulling it out, because she sort of knew the people. She was tied to the working class voters in that district and was able to speak to their concerns and separate herself from the top of the ticket. Obviously, overall in Washington, you do want to be with the Democrats, but in that specific district, she was able to hold on and win a narrow victory. I think one last slide here. So these are the remaining House races. Begich is going to win that race. Alaska's always a slow counter of votes. Having the ranked choice, which is going to go away after this cycle, delays them a little bit more. Then you've got some very, very close races. Golden, actually in Maine too, is another good example of someone who knows the issues in his district, was able to sort of play to that rather than just get sucked into the national vibes in Maine too, which Donald Trump won. So a couple more to go. Obviously, Republicans really do kind of need to win a few of these to sort of make sure that they have a majority after some of the folks have left for the cabinet.
Yeah, I think just one quick thing on those slides, both Miller Meeks and Michelle Steele. Miller Meeks, a ophthalmologist and leader on healthcare issues. She won her first election, I think, by 6 votes. They used to call her six pack. She's now the 800-pound gorilla because she's winning by 802. And Michelle Steele, a lot of focus on uh, competition in healthcare, driving more competition across health systems and insurers, and has a bill that is teed up for as a potential pay for at the end of the lame duck. So some interesting races to watch. But John, to your point, a lot of these races, multiple reasons for why people won or lost: crime, immigration, the economy was top of mind, people's personal situations, the ad that ran and was heavily focused on by Trump and the "we care about you, not they them." I think a lot of metrics around how effective that was, but multiple reasons. I think if anyone says this is just one reason why Trump or Republicans kind of swept, is ignoring the very granular micro issues that were playing out across the country in every district. So thank you for highlighting that. So we want to talk a little bit about how things are changing and some of the decisions that are being made now that we get to the 119th Congress. I think we're going to start out with the Senate and talk a little bit about the leadership election that happened yesterday. No surprises here. I know there was a lot of focus on whether Rick Scott would be the majority leader, but Thune is very much a more traditional Republican with an ability to kind of work within the conference to keep people together. Barrasso has been is a physician, obviously, and also has been kind of working with the conference and keeping things together for a number of years. Tom Cotton coming in as conference chair, and then Tim Scott as NRSC. Shelley Moore Capito will be the policy chair, and she's talking about the Trump agenda, immigration, inflation, crime, opioids, as a person from West Virginia. James Langford will be the conference vice chair. And all these folks have played in and around healthcare for a long time. A lot of folks on the relevant committees of jurisdiction. Thune is, for example, a huge advocate of innovation and integrating digital health and data into healthcare to improve efficiencies. Barrasso has focused a lot on provider payment issues. Tom Cotton has looked at coverage issues and competition and has a more of an anti-corporate, anti-status quo bent. Tim Scott, small business owner, insurance agent, very concerned about getting people into the right plan that best meets their needs. So a lot of bench here in the Senate, a lot of focus on healthcare, good leadership team. In terms of the committee chairs, though, I think there's some dances going on. I'll tell you what I think. So first of all, Mitch McConnell, obviously stepping down, has seniority, I think, on almost everyone except maybe Grassley. But he could take the Appropriations Committee if he wanted. We're not hearing that he will. I think he'll take Rules and then maybe Defense Prop Sub, leaving Collins as the full committee chair. At least that's what we're hearing, probably the most likely scenario. Finance, critical issue for the tax cuts and other reconciliation issues. Mike Crapo, not someone who's typically deeply interested in the healthcare issues, but knows them and is kind of a more trusted moderate, trusted conservative. On the Budget Committee, we're hearing Lindsey Graham will go back to budget and Grassley will take judiciary. Cassidy announced this morning he'll be chairing the Help Committee, and Ted Cruz, because Thune won, who had seniority on Commerce, Cruz will be likely the Commerce Committee chair, and is very focused on privacy issues, digital issues, particularly protecting consumers online, selling data and restrictions on selling data and things like that. So a critical issue that we're watching across all these new committee chairs and their ranking members. In the House side, we're focusing on the majority here because they're making the decisions. Surprisingly, no challenges to Johnson and his nomination. There was some rumbling from Freedom Caucus folks, but I think with Trump endorsing Johnson for the position, the leadership roles are not changing at all in the House, except for the conference chair. With Stefanik going to the UN, Lisa McLean is coming in to head up the conference position, beating out Kat Kamick. Kevin Hearn will be the new policy chair, and he beat out Gary Palmer. Very much a conservative, longtime friend, but he is very focused. The Republican Study Committee, which he chaired this Congress, put out a fairly extensive roadmap on healthcare, and would encourage folks to contact us for a summary of that, or to read through it yourselves. Then Richard Hudson had been rumored for Energy and Commerce, is staying at the NRCC. In terms of the committees, there's a bit of a dance going on in the House as well. Obviously, Kathy McMorris Rodgers retiring, race between Brett Guthrie and Bob Latta. We've been, Guthrie is obviously health sub chair currently. We think he's got the edge in the race. A strong focus on Medicaid issues. He's also done a lot of work on IRA drug pricing and the plan market and the need for reforms there, and reversing those ills. Latta was chair of the Commerce Telecom subcommittee, and strong focus on digital health, AI, supply chains, and drug pricing and PBMs. For Ed in the Workforce, we got an asterisk there. Tim Wahlberg, likely chair. There's a race there as well, but he has been working on and focused on association health plans for a very long time. It's his signature issue, and we would expect AHPs to be a key focus there. And at Ways and Means, same position, but there's going to be a lot of new members on all of these committees, with people kind of vying to fill vacancies for folks who are retiring or who were defeated. And so that dance is happening with the steering committee now, and as people lobby to try and get on these committees. And we can provide detail around those movements. And folks who are likely to kind of get on those committees, if you want to reach out to us. But want to switch to what happens next, and we'll talk a little bit about what's happening now and in December, before the new Congress comes in, and then before the new president is sworn in, and on Inauguration Day on the 20th. So right now we've got our leadership elections, the committee chairs kind of working things out. The steering committee is meeting. People are making their case for which committees to be on and which committees to run. New member orientations are taking place, and then people are really trying to figure out, what does the lame duck look like? Our sense is the lame duck gets smaller, not bigger, even though there's a strong desire from the president-elect to kind of clear the decks going into next year. There's a couple of critical things that have to happen, but Schumer is very interested in trying to move through as many judicial appointments as possible, and get really get to an historic level to make sure that there's key Democrats or like-minded judges on benches across the country to take on a lot of litigation that's probably going to happen over the next 4 years. For Biden, it's really about pushing any last-minute rules out, or doing sub-regulatory guidance, and spending money that's not spent yet on discretionary programs, and possibly any last-minute executive orders. Trump did some at the end of Trump 1. There could be a few surprises here from Biden, but there's a sense that he wants to, kind of exit and hand the reins over to Trump. So it could be a very quiet period for regulations. We'll talk about that in a little bit. But right now, everyone in Washington is fascinated with who's being nominated by Trump to sit in what chair, and who's going to be kind of running the show. We have insights into all that. I'm not going to get into any detail here. Obviously, the transition team is handling those kind of inbound things. I would say on HHS, there's a bench of 4 or 5 people that they are looking at for a top spot. And I think there's going to be some seasoned, good people coming into those roles who understand the department, who understand the agencies and the programs and how to get stuff done, which will be critically important. The first 100 days we're looking at electing the speaker, adopting the rules package, but they're going to get very quickly into a budget reconciliation process, and that means passing a budget resolution and then doing the hard work to get the policies in place to pass those off the floors of both chambers. There will be a debt limit that comes into play here. Expires midnight 1/1. We'll go into extraordinary measures and try and figure out how to lift that debt limit. And I'll talk in more detail on that in a second. John Thune has talked about the need to return to regular order on appropriations and get this process that we've fallen into, Congress has fallen into over the last couple of years, where we're passing these big omnibuses or minibuses or doing continuing resolutions on September 30th or thereabouts to fund the government off the decks and really go back to regular order on appropriations. We'll see if that plays out that way, but Trump is definitely interested in Congress moving on immigration and energy and a crime package, and fulfilling those campaign promises that I think was able to swing some voters his direction during the campaigns. And then we've got elevating some priorities for the midterm elections, and making sure that Republicans can keep the majority, or if you're a Democrat, you can retake the majority. For Trump, starting next year, there will be a shakeup, certainly in the federal workforce and the regulatory process and regulatory reform. And we'll talk about Doshi in a minute. But on the way out, these are the current regulations on the HHS that are pending with the administration. Perhaps the biggest one is the 2026 policy and technical changes to Medicare plans. CMS recently put out the rule on affecting provider payments in Medicare. The one that's of the most concern is docs got another 2.9% or thereabouts payment cut for 2025, and there's an effort in Congress to partially or fully reverse those cuts. A continued focus at HHS on digital standards for information exchange, use, and protection. And then the DEA telemedicine of controlled substances is a big issue, bipartisan opposition to what DEA has put on the table previously and what it's rumored to put on the table going forward. Looks like they may kick the can down the road and kick that into 2025 to figure out a good pathway for using telehealth to prescribe controlled substances for things like ADHD and buprenorphine and other things. On the lame duck side, though, you see a lot of issues on this slide. There are a lot of issues that are unfinished business for this Congress. I think at this point, what we're hearing is focus on the must-dos. The must-dos are the current CR runs out on December 20th. The federal government needs to be funded, whether that's a CR going partway into 2025 or all the way into September 2025, the end of the fiscal year, or passing some of the appropriation bills that, through the regular process that fund the government, all kind of up in the air. I know there's a strong desire from the Trump administration to clear the decks so that this is not an issue like the one he faced in 2017 that slowed things down a little bit, because Congress wants to get right away to the extension of the expiring tax relief. But funding for community health centers is a big issue. There's a strong interest in getting that done. I mentioned the doc pay cut and a desire to extend COVID telehealth flexibilities, which expire on December 31st. There's a few other expiring provisions. Third, Congress has spent a lot of time, 2 years, on PBM reform and getting better transparency into healthcare. Those provisions passed the House on a bipartisan basis. It passed the Finance Committee, Commerce, and Health Committees all on a bipartisan basis. So the desire is really to see something happen on PBM reform. In the House and Senate, there are bills that would delink reimbursement to the list price of the drug, and that's a pay for. So Whether it's just transparency or money issues or both, the desire is strongly to get something done. And then I know Guthrie, for example, has said if they can't get it done or if they only get part of it done, they're going to revisit it in 2025. So not an issue that's going away on PBM reform, and certainly something that members of Congress have spent a lot of time on. There's a number of laws that need to be reauthorized that are kind of waiting in the wings. I know Wyden and Warner are also interested in cybersecurity. And then there's multiple miscellaneous drug type issues like the Stark exception for in-office prescribing, which is a real problem for doctors getting medicines to patients through mail order or home delivery. There's a drug shortage challenge that's perennial and endemic, and Congress really wants to address that. That's probably a 2025 issue. And then the Judiciary Committee is having a markup on some patent reforms and ending what they call gaming of the patent system. Those could all be teed up for possible inclusion at the end of the year as well. So a lot on the plate, but we're hearing with a focus on getting people in the right seats, getting things teed up for next year. Some of these issues will probably fall by the wayside and have to be handled in regular order in 2025. All right, so some issues to watch going into next year. The first is the fiscal outlook and the expiring debt limit, which I already talked about. We've got a $1.9 trillion deficit, debt levels almost at 100% of GDP. And at the same time, we've got a lot of fiscal issues hitting, expiring tax relief. It's about $4.6 trillion over 10 years of tax relief, 70% on the individual side, 30% on the business side. But if nothing is done on that, taxes will increase for almost everyone in the country. And the top issue, the number one issue, and the first issue that will probably be addressed by Congress. We also, at the same time, at the end of 2025, have the expiring ACA enhanced subsidies, about a $300 billion issue, and strong desire from Democrats to extend those subsidies, less of a desire on the Republican side to get those done. Funding for both FY25 and 26, and then problematic ongoing problems like every year payment cuts for doctors as part of the macro program, a strong desire from members to address long-term reform so that doctors don't face annual payment cuts year over year. All these things are kind of coming together to drive an agenda, and we can start to see the contours of fiscal policy driven by tax coverage and payment issues in Medicare and private markets that will all probably be addressed in 2025. We believe 2025 is to be a massive healthcare year, whether it's on the tax or spending side, and we're trying to get ready for it. A lot of work has already been done in the House and the Senate to prep for reconciliation and to try and make sure that changes can pass with a simple majority. And I'm going to talk a little bit about reconciliation. I'll spend some time on this because reconciliation will come quick. It will be big, and it's going to be hard for people to break through the noise of reconciliation. If you've got a discrete issue on like mental health or prescription drugs, it's maybe smaller in terms of scope or impact. It's going to be really hard to kind of break through the noise and get your issue elevated. If you're not doing the legwork now or haven't done it to this point, you're already a little bit behind the curve. So I wanted to talk about how to maybe be involved in this process. I think the point I'd like to make is that there's few people downtown who have actually worked on reconciliation as a congressional staffer or a member of Congress. There's been 23 reconciliation bills signed into law since 1985, and I've worked on 2 of them in the healthcare space. And I think that makes us a little bit unique. It's an interesting process. It can be complicated and confusing if you're downtown. I want to stress that this process is highly orchestrated. The leadership is talking to the budget committee. The budget committee are talking to the to the committees of jurisdiction, all in a coordinated dance to get to a number. And what is that number? Well, reconciliation at its core is you're just reconciling tax changes, spending changes, and the debt limit to a set budget target. So you're reconciling those accounts to say, all right, if we want to cut $4.6 trillion in taxes, what is the debt? What does the budget target look like for the deficit, perhaps the debt? How do we get to 4.6? If we want to do less than that, say we want to do 1 trillion, how do we reconcile the policies to produce $1 trillion in tax cuts? Reconciliation can be used for both uh, taxes and spending. You can increase or decrease those levels. And the important thing, though, on the spending side is it only applies to mandatory spending or direct spending. It doesn't apply to things like the education department or defense spending, which is appropriated every year. So the process uh, goes something like this. The budget committee will produce a budget resolution. That resolution will include reconciliation instructions to the different committees. There will be a number that those committees have to hit by passing changes in law and policy. And the committees will then take that number and they'll draft legislation working closely with CBO. They'll advance it out of committee and with typically with a set deadline in accordance with the budget resolution. Those bills get reported to the budget committee. The budget committee may then combine those into one big package and report it to rules for floor consideration. The chambers then take that bill up, pass it or don't. Typically, they'll pass it. And then those differences are resolved and it's either sent to the president and enacted or vetoed. The big thing here, though, is this process is governed by rules. And the first thing is that it has to impact spending, revenue, or the debt limit. And Social Security is off the table in reconciliation. The any changes in the bill that don't result in changes to spending or taxes, like a reauthorization of a program, for example, can be kicked out by what's called the Byrd Rule. And I'll get to Senate procedure in a second. Congress can do a reconciliation bill in any fiscal year. So right now we're in the middle of FY25. The next Congress in 2025 can do 2 reconciliation packages, which theoretically could produce 6 bills. One on spending, one on tax, one on debt. Congress often combines these bills into a spending and tax package. It's very rare to consider a debt limit increase on a reconciliation bill. So we don't think they're going to do that for a lot of reasons. But we do expect at least one, probably 2 reconciliation packages in 2025. There will definitely be a reconciliation package for tax. It will probably be combined with the spending changes. And I know the conventional wisdom in DC right now is that there'll be a tax bill and then there'll be a spending reconciliation package. We think they'll actually be combined because members of Congress are very focused on the fiscal environment and the debt limit and the deficit. And so they want to get that package as close to zero or even under zero deficit impact as possible, which will include a mix of if you're doing tax cuts, maybe you're doing less than 4.6. You've got some revenue raises in there. You've got some timing issues. Maybe you're also cutting spending to help offset that. And that's going to be big changes. That has to come from Medicare, Medicaid, ACA, other direct spending accounts. Anyway, so it's got to affect mandatory spending. It's got to affect taxes. And it's probably going to be 2 bills in 2025, but the package will probably be a tax and spending bill right out of the gate. So the Byrd Rule, say the House passes the bill, goes to the Senate. There are restrictions on using the filibuster. It only takes a simple majority to pass the Senate, but senators can proactively raise objections to provisions in the bill under the Byrd rule. The Byrd rule basically says if an item doesn't have a direct budgetary consequence and therefore is unnecessary to achieve the budget impact defined by the resolution, it can be kicked out. And these are things that don't result in changes to spending or tax or the debt limit. If it raises the deficit outside the 10-year window, if it's just incidental to the budgetary savings. So say like Association Health Plans saves $2 billion by lowering premiums or raises $2 billion by lowering premiums. That's incidental to the budget impact. And so that could be kicked out with the Byrd rule. And like I mentioned, you can't change Social Security. So it is a process and a dance that goes on in the Senate. The House is very aware of this. They won't put stuff into the House reconciliation package if they think it will get birded out or taken out of the bill. So it is a big process. It can be confusing if you're looking at it from downtown. If you've been on the inside and you've worked on a couple of these bills, it's actually all makes sense. It's logical. But there's a way to get your things into the reconciliation packages and a way to argue it to the Budget Committee or the Ways and Means Committee or the Finance Committee to be able to achieve the goals that are necessary to live within the reconciliation box and actually get it signed into law. So with that, how are House and Senate folks thinking about this? So first, all Republicans believe that some or all of the 2017 tax relief should be extended. There is a strong focus right now on that top line number. Well, what's the target budget impact that we need to hit? What does that look like? How are the committees going to hit that number? What are the policies they need to enact? But any bill, there's a strong sense in both House and Senate Republican conferences that at the very least, any bill shouldn't increase the deficit. There's another sense that economic growth as a result of the tax cuts will help offset all or part of the lost revenue from the taxes. So they're looking across several areas in the healthcare space: Medicare, taxes, Medicaid, and ACA. These are potential health issues on the list. These are not things that are absolutely going to happen. But you can see in the Medicare side of things, strong interest in the IRA. In fact, the desire from most Republicans in the House is to just outright repeal the IRA. And I'm not saying that's on the Medicare side. I'm just saying the law writ large, which produced green energy tax credits, other programs around green energy, and other tax changes and funding to the IRS. The strong desire is to repeal that law. Obviously, there are Medicare changes in that law that have a budget impact. And if you did that, you'd have to figure out how to make up the revenue. Medicare Advantage, big target right now in terms of what MedPAC calls overpayments to plans. A big focus on site neutrality or paying the same rate for the same service across sites of care. And then a desire to elevate primary care and get more prevention into the agenda. And you can read the other things on the list here. I think Medicaid is a strong focus, desire to do structural reforms in Medicaid. On the ACA side, a lot of talk about the expiring subsidies. But on the Republican side of things, desire to maybe take a look at those subsidies and see whether they're inflationary or not. A lot of issues around fraud and making sure that people who get subsidies are actually income eligible for those subsidies. On the tax side, a strong desire to expand HSAs and something that the RSC and others have put on the table, capping or repealing the employer tax exclusion for covered benefits. So there's a lot on the list. Narrowing these down will be a challenge. Reconciling them to the top line budget number will be a bit of a dance. And then if you do repeal some of the Medicare IRA provisions, what do you put in their place to make sure that, for example, people's out-of-pocket costs don't increase? So wanted to talk a little bit and switch over to the administration, because we're going to have multiple things happening at the same time while Congress starts working on reconciliation right out of the gate. with healthcare implications. President Trump will come in and have a huge shakeup in the executive branch. So in general, he is I don't want the government to run healthcare. I don't like Medicare for all, but he's definitely not a purist. On the MAGA side of things, like I think, he supports price controls, a populist kind of high polling issue, as John can attest. Uh, Not opposed to more funding in healthcare or spending more money on benefits or other programs. And the new twist from this campaign cycle was the Make America Healthy Again agenda. On the more conservative side, to traditional Republican side, definitely more traditional views on expanding transparency and competition, choice, allowing consumers to choose their own program, a deep focus on eliminating waste and fraud or inappropriate payments in healthcare. We'll see that in reconciliation as well. And then excellence in outcomes, value-based care. And while he's opposed to big tech writ large, very enamored with AI and digital health tools to improve healthcare efficiency and outcomes. So that's kind of just big overview. But on the expected executive activity, every tool at the administration's disposal to advance the Trump agenda will be deployed, and then some. So first and foremost, a reorganization of the federal workforce and trying to get around some of the maybe what's perceived as career staff blocking the Trump agenda. Program reforms, including demonstration reforms in Medicare that are being carried out that are producing not enough savings or outcome improvements. Contracting reforms and really starting to figure out how does the federal government maybe contract out a lot of its functions to improve efficiency, say in waste, fraud, and abuse, deploying AI solutions to identify, spot, and stop fraud. Regulatory reform, very consistent with recent decisions in Loper Bright and West Virginia versus EPA. And then tapping outside experts. The interesting thing here on this chart from the American Action Forum is that in the Trump administration, there was a strong focus on what was called the one in, two out policy, or every regulation, new regulation, you've got to think about how to take regulations off the books, a deregulatory approach to improving economic growth and burden reduction on businesses. That was very successful. So they ended up with a net $3 billion increase in costs compared to hundreds of billions or even trillions of dollars in increased regulatory burden from the other two administrations. That process or a similar process will likely be deployed again. And so as you think about regulatory advocacy, thinking about regulatory burden relief needs to be a big part of your strategy. And you can see the last thing on that slide was tap outside experts. And I want to highlight this as opportunities and threats. So the DOGE opportunity, the Department of Government Efficiency, outside experts, Elon Musk and Vivek Ramaswamy, have been tapped to kind of run through this process that'll go through July 4th, 2026, the 250th anniversary of our country. The main goal is to identify inefficiency, fraud, waste across the entire federal government. They will partner with the White House and OMB for large-scale structural reforms, and we'll ask the public for help in identifying regulations, programs, and solutions to things that the federal government shouldn't be doing or are doing that could be done better or more efficiently through contracting out or through process reforms. The legal basis, the mandate for doing this is 4 Supreme Court cases. I mentioned West Virginia versus EPA, Loper Bright, which is the Chevron decision, SEC versus Jarsky, and the Corner Post decision in 2024. They're going to go back to 1932 and take a look at every regulation that is a burden and figure out whether to get rid of those regulations, revise them, or go to Congress with a request to change the law. On the waste, fraud, and abuse, like, yeah, they'll look at the $10,000 spent by NIH to look at transgender monkeys, but they're also looking at the hundreds of billions of dollars in fraud that are endemic throughout the government programs, and figuring out ways to deploy technology solutions or other solutions to really start rooting that out. And the last thing they're going to take a look at is there's about $516 billion of unauthorized programs that are currently funded. And they're going to say, if those programs aren't authorized, we're going to defund them unless Congress reauthorizes them. So it is a extensive effort. I think it's going to be similar to the Al Gore reinventing government effort from a couple decades ago on steroids. Like, this thing is going to be big, in my opinion, and it'll produce lasting change at the executive branch level with regulations and programs, demonstration programs, et cetera. So something we're paying close attention as an opportunity for solution providers and people who say, I've got a better way to do this, or I can do this in partnership with the government in a way that makes more sense. I did want to mention the MAHA movement. This is the RFK, Callie and Casey Means type effort to really clean up food, air, water, soil, and a strong focus on fitness and medicines and vaccines. And tapped into really a populist view that some of these things are making us sicker and leading to widespread epidemic and chronic diseases. And so we've heard from a lot of our clients that there's a big concern with how these issues are portrayed in the media and by people like RFK. I think that a challenge here would be to, point to the data, point to the science, particularly, like, say, around vaccines. And we don't want new outbreaks of measles or smallpox in the US, for example. And so how do we make sure that we're not promoting vaccine hesitancy? We're really addressing the core issue, which is chronic disease is driving sickness and costs. The key way that RFK and I think Trump and others look at this is that there's regulatory capture of CDC, NIH, FDA, USDA by strong, powerful corporate interests who have an interest in maintaining the status quo. They've got an interest in sick people staying sick so that they can sell more products to those people. So that's kind of the perspective of the MAHA movements. There's an opportunity in there, and that is to really get at chronic illnesses and starting to address those root causes. And so we'll be working with them to make sure that opportunities are elevated and threats are minimized. So in kind of getting to the end here, I wanted to wrap up and say this is our election tracker. You can get it on our website. As I mentioned, we take a look at every race with the candidates where there's in each cycle, and take a look at their health agenda. And if you go to our website, you can see the winners, losers, and for the winners, they're going to be members of Congress. They've already identified some of the issues that they care deeply about. It allows us to go in now in December and January to say, hey, I know you're interested in physician payment reform in Medicare. We want to work with you on that because we work with 20,000 oncologists across the country. Or we saw that you were interested in drug price reform. We've got multiple ideas on that as you think about reconciliation. So go there if you want to take a look at some of those reports and individual candidates, and we can help you walk through and identify who those people are and where we think they'll be most interested and most effective. And then just lastly, if you're a client, existing client, thank you. If you have an interest in working with us, our goal is to make healthcare work better. And we do that by advancing our clients' interests and elevating opportunities for them to be engaged with government. We do that at the federal and state level through legislative regulatory advocacy, We run or manage 5 coalitions where we are interacting with 200 different groups every month to gain allies and diverse voices that are then elevated in the advocacy space. We're also really good policy experts. Like I worked on 9 different laws, mostly in the Medicare space, but creating the Part D program, creating health savings accounts. Brett Meeks on our team worked in the Senate for 10 years for Senator Alexander on the Health Committee, very fluent in the digital health space and AI, telehealth, telemedicine. Sloan Salzberg, Jen Bernstein, Jen Steger, Shannon McGurl. We have experts across all these areas in healthcare, but we're exclusively focused on healthcare, and that's a big difference where we can help ensure that our clients in the healthcare space are making healthcare work better for all Americans. So I wanted to thank everyone today. Thank you. I see some question Q&A in the submitted file there. We'll get back to you, rest assured. And if you want to reach out to us, please do so. Thank you very much for attending today.